I chose to pursue accreditation primarily because it is a differentiating factor. I think it's important for patients to understand and recognize a fellowship-trained Mohs surgeon as opposed to someone who just received standard residency training or perhaps a weekend course or something relatively similar to that. And SRC really values fellowship and has a rigorous accreditation process to really validate the surgeons and the facilities that it represents. I think accreditation provides validity to the surgeon and facility that is accredited, but also takes a lot of the guesswork out and the homework necessary from the patient's perspective. You know that if your facility or surgeon is approved and accredited by SRC, they've done all the homework for you, and you know that you're going to get top-notch care. The significance is huge. All residents in dermatology receive some exposure to Mohs. But even at the most intense programs that provide the most exposure to surgery, to Mohs surgery, are only allowing their residents to do so much. You really don't get the hands-on training that fellowship provides. I think fellowship is key. Without a fellowship in Mohs, it's kind of a big statement to make, but I don't know that there's enough training out there via other mechanisms to give you the same level skill set that fellowship gives you. So I think it's key. I think if you're going to do Mohs, you need to do a fellowship. So the fellowship entails a year or two. There are a few fellowships out there in the country that are 2 years. Most are a year, where you're essentially attached to a senior Mohs surgeon at the hip for everything. Every case, every Mohs layer, every reconstruction. There's pathology training. You're spending a lot of time with the microscope. You have to do quite a bit of research, reading. You have to really know what's going on in order to graduate and become proficient in all things Mohs, which again are microscope, the surgical removal of the skin cancer, and also the reconstruction. It's typically 500 or more cases. In my fellowship, there are about 1,000. In some fellowships, there are 2,000 cases that you do in addition to what you did as a resident. And to reiterate the point, nothing replaces experience when it comes to being able to do Mohs proficiently.